And now we are turning to Iowa's first and only toxicology clinic. University of Iowa Healthcare opened the clinic a few weeks ago to treat patients suffering from exposure to heavy metals, pesticides, industrial chemicals, military-induced toxins, and a whole bunch more. And this morning, we sat down with the clinic's director to find out just how important this clinic is. We're joined now by Dr. McCabe, the director of the Toxicology Clinic. Thank you so much for joining us today.
Thank you for having me, Shelby. Really happy to be here and happy to speak about the new opportunities we're providing.
I mean, I can imagine this was a long time coming. What does it feel like for you to be at the finish line, which is, I guess, really kind of the starting line?
Yeah, I agree. It is the starting line and finish line. There's a lot of support staff that have worked really, really, really hard to bring this to fruition.
I got to ask you, when we say the first in a state, it's an incredible distinction, but it does make me wonder, why has this not happened sooner? What are some of the challenges that come up with starting and running a clinic like this?
The easiest response is there haven't been enough toxicologists to make this happen previously. Toxicology is a very rare subspecialty, and there's very few of us in the country. And over the last 6 to 7 years, the University of Iowa has been able to recruit a few of us to actually come to the University of Iowa and have a bedside service. So we can actually, starting 5, 6 years ago, was the first time that you could ever be seen by a toxicologist bedside in our state. And then when we started building the group and building the infrastructure of having a clinical service, having a division, then it kind of became, it was a natural progression to also then allow these services into the clinic.
Clearly, the school, all of the staff involved, you are seeing a need there. What sort of need are you anticipating with this clinic once word gets out about it?
What we're anticipating seeing, and the clinic's been going for a couple weeks now, and so we've already seen some patients. A lot of what we see are cases that are relatively rare for a primary care provider, different heavy metal exposures, tests that are pretty rare that they've now need to have someone to interpret. The patients are scared. They want a subspecialist to explain where this may be coming from, what treatment options there may be, what this may or may not affect their health. And so, without diving into the weeds of all the various poisonings that can happen, uh, essentially, we just want to be a resource to providers and patients in these times of rare poisonings that, for a toxicologist are not that rare.
And I understand you're particularly interested in studying some of these long-term effects as well.
Yeah, so that's when we're thinking about taking care of patients in an outpatient or a clinic basis. A lot of our focus ends up being more chronic illness or chronic effects, which is different than what we take care of in emergency departments or when we admit a patient to the hospital. And so some of these effects that we think about are is this poisoning? Is it affecting any of our other organ systems? Is it causing any other long-term issues that we can try to help with or try to prevent?
Well, before I let you go, is this the type of clinic that you would need a referral to? Do you accept walk-ins? How does it work for patients?
So at this time, it is a referral only clinic. And again, that's an attempt to partner with the primary care provider. We're not primary care providers. I'm not a primary care provider, and I cannot speak to their level of expertise when it comes to managing all the different non-toxicologic issues that any patient may have. And so we really want to partner with our primary care providers to send the referral, because after we help with the toxicology related part, we really are going to rely and partner on our primary care colleagues to kind of move forward together and kind of join both the toxicologic concerns and the non-toxicologic concerns going forward.
Now, the new clinic will use a targeted approach when it comes to patient diagnosis. So Dr. McCabe says that, as opposed to ordering a bunch of tests, will actually be more time and cost effective for patients. For now, the clinic is open every other Wednesday.